Well, welcome to today's update. It is Friday the 8th of May and that makes it Victory in Europe Day. And this picture was actually sent in by Elizabeth in Australia. And it's the memorial she set up at the end of her drive for Anzac Day because they couldn't have the usual memorials. So it just seems appropriate to remember that. It's the 75th anniversary of Victory in Europe Day. 8th of May 1945. Now, I want to do a bit of a focus on various places today, and there's some interesting things coming out because we're actually learning things about this virus now that are applicable everywhere, and information is being replicated, data is being replicated in other countries, indicating that we are learning fundamental things about this virus. And there's some very interesting data from Canada that shows us this and helps us to understand the nature of the virus. And it's also important because we've got 37 million Canadian friends over there as well. So let's start off by looking at Canada today. Then we'll look at some other places as well of interest in a minute. Now, Canada, 66,000 cases, 4,500 deaths. Always look at this in the context of the population, of course. This is 37 million people living in Canada. Now, 55% of the cases recorded in Canada are female, 45% male, and 36% are over the age of 60 years. Now, I actually don't think this is relevant. I think this virus infects everyone equally. I think the disparity here probably reflects testing in Canada, because I don't believe there's more females infected in Canada than males. And likewise, all ages are affected. But it is interesting that the Canadians have come up with this data. Now, trend-wise, the Canadian authorities are saying, which of course I'll post the link to, new cases continue to be reported across the country. However, the rate of increase continues to decline. But of course, this still means that the total number is increasing. And I have expressed concerns about Canada over the past few days. And the Canadian authorities are saying the number of illnesses in Canada is continuing to increase and has not yet peaked. So unfortunately, we are going to see more cases, and that's going to be associated with more deaths in Canada. Now, I wanted to show you some of the very useful illustrations from Canada here. Now, this one is the Canadian epidemiologists have recorded the distribution of COVID-19, 33,000 cases at the time this data was collected, as of the 7th of May, in terms of age distribution. So they find that there's less young people here, less people aged 70 to 79 here, more people in the 40 to 59 age group. Now, the question is this relevant? And the answer is, I don't think it is. This virus affects all ages equally, I believe, is the data that's emerging from around the world, in that all ages can be infected equally. But of course, we know the morbidity and the mortality is massively different in different age groups, with older people suffering more severe illness and much more likely to die than young people. Although, having said that, young people can get serious illness, and we have been concerned about this inflammatory syndrome that's been documented in Italy, the United States and the UK. But as a general trend, it's the older people that are getting affected more, but everyone, I believe, can be infected equally. And of course, that means all ages can transmit the disease equally. Let's just look at this without me in the way. Yeah, this is good. So this is the number of cases in various regions in Canada. So the darker the blue, the higher the number of cases. And we see the numbers recorded there. So a very useful graphic here from the Canadian government. So we see that most cases are in fact in Quebec at the moment. Fewer cases there in New Brunswick and a few more in Nova Scotia. Ontario we see as a medium dark blue. Manitoba and Saskatchewan less. Alberta and British Columbia, the colour speaks for itself. Going north to Yukon and Northwest Territories, fewer cases, and Nunavut, no cases. I don't know if anyone's living in Nunavut at the moment. I mean, I imagine that Baffin's pretty cold this time of year. So, but I thought that was interesting that they give this. Did I mention Newfoundland? I can't remember. Fewer cases in Newfoundland. So it's quite useful that the Canadians seem to be giving that geographical data in such an easy to understand form. Now, this is the probable exposure. So the probable exposure is how people contracted the illness in Canada. And they believe that about 19%, or fairly accurately 19%, that they can trace epidemiological links to foreigners that brought or travellers that brought the virus into the country. But 81%, as we see here, is in the community setting. And of course, this is very significant because we've seen this everywhere. It starts off as individual cases, then clusters, then there's community spread where it's not possible to trace an epidemiological link. So that means that there is this ongoing community transmission in Canada, as indeed, unfortunately, there is pretty well everywhere in the world now, with few exceptions. But there are a few exceptions, such as Taiwan, South Korea. So community transmission, as unfortunately, is the norm now. Now, this is an age group, percentage of COVID-19 cases with detailed cases information that are hospitalised and admitted to ITU. So this is the proportion of people in a particular age group that are hospitalised. So, for example, if we take the 50 to 59-year-old age group, we see that 15% of cases are hospitalised and 5% of those required intensive care. Likewise, in the older age group, we see that 42% of people infected were hospitalised and 11 required intensive care. And even in the younger age groups, we're still seeing some hospitalisation, but the darker blue representing those that require intensive care. Now, this is an incredibly significant set of data because it is fairly consistent with other countries around the world. And that means, I believe, we can expect this trend to be repeated in other countries around the world. And I was talking to Etta off air yesterday, and I'm sure she won't mind me saying this, but we were talking about the proportion of cases that are admitted to intensive care in Western countries, these proportions here in various age groups. And in the situation in Malawi and other countries where the intensive care facilities are not available, then I would expect most of those patients to die who could otherwise have been treated if they'd been in a more advanced healthcare setting. So this gives me cause for this graphic here is interesting from the Canadian perspective, but it also gives me a lot of grounds for pessimism in poorer countries that simply don't have the intensive care facilities that Canada does. So does that mean that in the 50 to 59-year-old age group where there's no intensive care facilities, we can expect a 5% case fatality rate? That is my fear. That is what I fear. And even with these cases that are hospitalised, we don't know what proportion of these patients that were hospitalised would have died without interventions, because of course there's a whole spectrum of interventions that are less important, that involve less medical care and less nursing care than intensive care. So some patients, for example, might need oxygen for 3 or 4 days. Now, what we don't know is what proportion of those patients would have died had that oxygen not been available. And likewise, a lot of patients are given intravenous antibiotics to treat bacterial secondary infections like bacterial pneumonia, which can be a secondary infection. That was a very common cause of death in 1919 influenza H1N1 pandemic, because of course antibiotics weren't available then. So what proportion of these hospitalised patients would die without the quality of hospital care they got in Canada? Again, we don't know. So it's good that Canadian medical authorities were able to cope with this, as indeed in many Western countries. But this graph does raise quite significant alarm bells about countries where the healthcare infrastructure is much more challenged than in Canada. Now, this is by gender, the percentage of COVID-19 cases who were known about that are hospitalised and admitted to intensive care. So again, as we would expect from data from other countries, and it's always good to get this confirmed, in Canada it was 13% of females infected, hospitalised, 3% in intensive care, 19% of men, 5% in intensive care. So again, we see men are getting more hospitalisations than women, and more men admitted to intensive care than women. And again, this is the pattern we've seen around the world, that men are suffering more severely from the disease and dying more from the disease than women. And I think this is the final Canadian graphic. Again, interesting. The red lines are the doubling days. So doubling time of cumulative number of reported COVID-19 cases in Canada. Again, for 63,000 patients. So this is very high quality data. And we see that doubling time was slow in the initial stages. But then when community transmission became established around about here, then we got a great increase in the number of cases. So the early days of community transmission around about there are getting doubling times of down to 3 days. 3 days, 4 days doubling time. So without the lockdown measures that were instigated around about this time, this rate of doubling could have carried on increasing. It's been slowed by the community health measures that Canada has taken. And again, this makes me somewhat more very pessimistic for other parts of the world, because this means without social isolation and social lockdown procedures, we can expect doubling times of this virus of every 3 days. And that is really quite alarming, that the number can double every 3 days. Now, other interesting information coming out of Canada. This is symptoms and severity in Canada. So again, getting this confirmed is good. So of all the people that were examined and the clinical information recorded, those that tested positive, 74% had a cough. And this is, again, this is fairly consistent with what we've been seeing. 56% had headaches, and 54% had weakness. Now, we know there's other features as well, but again, these were the most common ones. Interestingly, it doesn't mention fever there. I'd expect the fever to be round about the same as the same incidence as the cough, actually. But that's, again, it confirms. And most of these, of course, were dry coughs, as we got in the initial cases, as indeed Etta suffered from in yesterday's video. 3,500 people hospitalised, 827 in intensive care in Canada. So interesting things in Canada there, very largely confirming what we know, but we know that this is recorded by high quality statisticians, by high quality epidemiologists in Canada, so it's highly reliable data. And it tells us fundamental things about the virus. And it's completely clear to me from this that this is exactly what we can expect in other countries as the virus spreads into other areas. I would expect the virus to interact with people in very much the same way. And that does raise great concerns if the condition cannot be mitigated by good quality health care. Now, moving on to the United States, again, we noticed that there's 1.25 million cases in the United States. The per capita total cases is still higher in the UK, Italy, Spain. So we have to look at this in context of the population, but it is increasing. And the total number of deaths does look pretty bad at 75,000. Now, 43 states are actually starting to reopen now. Now, let's be quite clear. This will lead to more cases. As the lockdown eases, there will be an acceleration of cases. There's no question about that. In time, more people will become ill. In time, more people will die. But this is a decision that individual states are taking. Now, having said that, many states are opening very tentatively. We're not going back to normal. There's still increased hygiene. There's still the social distancing, the masking, all the physical precautions, the perspex shields in shops. But it's still going to result in more cases, in my view, unfortunately. Let's just hope that the strategies that they're putting in place mean that there's not so many more cases. But we can anticipate more cases as the lockdown progressively eases in the United States. Now, New York reported 66% of recent hospital admissions came from people who stayed at home. Now, we saw Governor Cuomo on TV yesterday or this morning, I can't remember, yesterday, probably this morning my time, yesterday, US time, saying that he expected more cases in people that were at high risk, like healthcare professionals. But that's not what they're seeing. These people were people that stayed at home. So what is going on here? This is really quite hard to explain. In fact, I can't really explain it. Somehow these people have contracted the virus while staying at home. Difficult to explain. It'll be interesting to see what the New York State epidemiologists come out with on that one. At the moment, it's a bit of a confusing picture. Wait for clarity on that. Now, greatly increasing cases in Minnesota, Iowa, Wisconsin and Nebraska, I'm afraid. And indeed in Los Angeles, there's more cases. And this was appalling. There was two employees in McDonald's attempting to enforce or instruct appropriate social distancing who were actually shot. Quite appalling. Everyone needs to obey the law on this. Otherwise we have anarchy, and I'm just very sorry for those two individuals that were killed in this way. So unnecessary. Quite terrible, really. Now, South Korea, this is interesting. Numbers of cases and deaths fairly flat, but there's been 15 new cases from people in nightclubs in Seoul. Now, nightclubs in Seoul, interesting. Indoor environments, often not well ventilated. High possibility of close contacts between individuals. And there's been spread in nightclubs in Seoul. And also that means that there are still cases there to seed these outbreaks. So it means there are still cases floating around in the community in South Korea. And just shows the risk from nightclubs there in these more intimate indoor environments, 15 new cases. Now, having said that, the South Korean authorities are very aware of this, and of course they've taken steps to isolate them. They've been tested, traced, isolated, and the contacts have been isolated as well. So I'm optimistic that can be contained, but it is a bit disconcerting because it does show that the virus is still there. It hasn't gone away from South Korea. Few new cases. I think there was 2 new cases picked up at the airport as they're screening everyone that comes into the country. Now, Russia. This is terrifying. We noticed that 3 doctors had accidentally fallen out of windows in Russia, which is just terrifying, appalling beyond description. Let's hope there's no more such accidents. But we do notice the number of cases is increasing. That was the number up to today. That was the number yesterday. That's the total number of cases in Russia at the moment. So it's the 6th consecutive day with over 10,000 new cases. So no question that there was a great escalation of the number of cases in Russia, and of course that's going to feed through to deaths in time. South Africa, quite successful so far. testing's more limited than we'd like, so we don't know how accurate these numbers are. But there's a gradual relaxation, even though most people are still not back at work. So again, with the relaxation in South Africa, we can expect to see more cases. I'm not saying they don't have a choice, that there has to be reopening. People are getting hungry. But it still does mean there'll be more cases. Again, I'm particularly concerned about the crowded conditions in many of the townships in South Africa, where you have multiple generation occupancy of a small, often a single-roomed house. Brazil, South America, again, very unfortunate denial from the political leadership in Brazil, and there's no doubt that the people of Brazil will be paying for that in much more hefty terms than this over the next month, I am afraid. Likewise, Chile, increase in new cases. Again, that was yesterday, 1,500 new cases, 1,000 the day before that. 24,000 cases now, and the deaths increasing. Again, we know that the deaths will carry on increasing. We saw the preparation for the dead in Santiago with large-scale cemeteries being dug. Now, the districts in Chile are going into what they call a dynamic approach to quarantine. So in other words, if they feel they can open up one area, they will, then it might close down again. Then another area might close down and open up. It's going to be like a dynamic opening and closing, increasing restrictions, lesser restrictions, dependent on geographical area. And again, these restrictions on geographical area we are seeing now. For example, yesterday we noticed that France is colour-coded by geographical area. Paris still being a red zone, which is still locked down, whereas other areas of France can be more opened up. So the whole country is colour-coded according to the level of lockdown easing that can be allowed. Health passports are being introduced in Chile. So to move, some people might be given a clean bill of health that they can move around, whereas others won't be able to. Almost certainly going to be on mobile phones, similar to the Chinese situation. And it looks like you won't be able to work without a mobile phone green pass on your phone in Chile. Now, India, again, still concerned about India. The official cases are low, 41 days of lockdown, but it's now being eased. Delhi's going back to work. So we are going to see an exponential rise in cases in India, I am afraid. They've delayed it. Let's hope they've made the best of that delay by developing science and developing testing. But there is going to be a great increase in cases in India over the next month. Of that, there is no question, unfortunately. I just hope it's a smaller increase than I suspect it may be. Cities divided into red, yellow and green zones, a bit like France really. So whereas all of Paris is red, in India cities are subdivided into districts. So there could be a red zone next door to a yellow zone next door to a green zone, all within one city in India. And restrictions enforced accordingly, especially in red zones, as red zones remain locked down. Now, these are the cases in Mumbai, these are the cases in Delhi. We know they're underestimates, but that's what they're saying at the moment. Now, that's basic, most of what I wanted to say today from the general roundup. But I will just quickly report from the UK, because there's something I've been thinking about here. Now, we know the cases and deaths in the UK are increasing. We know that the deaths in the UK are the highest in Europe, unfortunately, but that's the way it is. Now, this is interesting. I reported a couple of days ago on the Office for National Statistics, and we noticed that in this week ending the 24th of April, there was nearly 22,000 deaths, a bit down on the week before. But we noticed that there was 11,500 deaths more than the 5-year average. But only 8,758 of these mentioned coronavirus or COVID-19. So that means we've accounted for COVID-19, but we've still got an excess of 2,781 deaths. So it looks like the excess of deaths, the increase of deaths in the UK is higher than can be explained by the recording of COVID-19 or coronavirus on the death certificate. Now, at the time I did say this probably means that there's quite a few cases of COVID-19 that are undiagnosed. And I still think that may well be the case. But what I've been thinking is quite a few of these 2,781 cases could well be people dying of other conditions because of perceived limited access to healthcare. So normally when someone would get chest pain, they'd immediately go into hospital. They'd call for help immediately. And a myocardial infarction may well be diagnosed. Now, the trouble is with these heart attacks called myocardial infarctions is that the heart, instead of the heart beating regularly like that, in what we call sinus rhythm, it can go into a rhythm like that where it just flutters. That's called ventricular fibrillation. And it means no blood is pumped out, and it means your person dies in 3 or 4 minutes. Now, in hospital, of course, we can treat that very readily. I've done so many times. And a very dramatic procedure, but a very satisfying procedure because the person is resuscitated often very, very quickly. So that's good. But at home, of course, they would just die. So the big concern is that people are dying of other things because they perceive that they don't have access to healthcare. Now, in the UK, we do have healthcare provision for emergencies. So if you're in the UK, whatever you do, if you have another health emergency, contact emergency services as you normally would. They will triage you. Let them worry about that. You just contact them. Heart attacks, strokes, other conditions, even people with more chronic conditions. Does this 2,781 include some people with cancer, for example, who have not been treated as regularly as they would normally have been? So that's very concerning. And of course, this has got implications for other parts of the world as well, as more and more of the healthcare provision that's available is taken up by COVID-19, less other people might be treated. So there's a real issue for health provision to examine here around the world of triage and prioritisation of healthcare provision. So that's quite concerning. So as we've noted before, so people are suffering from this pandemic from the virus, but as well as that from other aspects of reduced healthcare and other difficulties caused by the virus, as well as the virus itself. So that's a bit of a roundup today. Now, question and answer consists of one question today. People say, are we expected to wear masks all day? The answer is no, absolutely not. You don't need to wear them in your own home. The time to wear masks particularly is when you cannot maintain social distancing with other people. And that tends to be public transport and shopping. So we need meticulous hand hygiene going into shops, inside shops, and mask wearing inside shops where we don't have effective social distancing. And even if we do have social distancing, we're still breathing in the same air. So I think the key time to wear masks is public transport and when shopping. Not necessarily, in fact, not out in the street in the fresh air. It's just when you're close to other people, particularly indoors, is when I'm advocating wearing masks. Okay, I think that's all I wanted to say on that today. Now, you know I'm not a conspiracy theorist on this channel, just before we look at some viewers' pictures. I don't go in for weird stuff, but something very spooky has happened. It really is strange. It turns out that Wallace has got a room just the same as mine. And Bob in Sheffield was able to identify this. And he's even copying my mannerisms, look. So, very strange. Very spooky. Right. Now let's go on to some of my people that like to watch. Let's look at some individuals here, just a few. Okay, this is Alison and Dennis who watch from the UK. Looks a bit dark there. Still got your Christmas lights up. That's fine, if you want to, that's fine. This is Alistair who watches in London. Thank you, Alistair, for watching. Am I on the screen here? Yes, we are. This is Alan, who watches in Cornwall. Thank you, Alan. Good to see you're watching in Cornwall. This is Ambi from Varanasi in India, who's taking vitamin D. Cholecalciferol is a vitamin D form. Not quite sure what dose it is, but good to know you're watching Ambi anyway in Varanasi in India. This is Annalacia watching in Texas. I think I said yesterday Texas was the Lone Star State, and I don't think anyone's written in to say I'm wrong, so I think it must be. This is Barbara and her team in Hungary. Not impressed by the social distancing here, but I'm glad to see everyone's wearing masks and gloves and taking good hand hygiene precautions. Thank you for sending that in, Barbara. Oh, this is Barry in Brazil. I think they're selling masks. This is Beatty in Berlin. So good to know you're watching in Berlin. So 20,000 units. I'm pretty sure that's 50 micrograms. That's what I'm taking. 50 micrograms or... Oh, I've got mixed up again. I'm not sure about the units. I take 50 micrograms anyway. Anyway, good to know you're watching PT in Berlin. Catherine is watching also in Texas. Good to know people are watching in Texas. And this is Jane in Salt Lake, Utah. So I think Salt Lake's in Utah. This is challenging my geography. But good to know you're watching there. Now this is Jason, who watches in Florida. Looks like he's got 3 versions of me. So thank you for watching in Florida, Jason. This is John in Kosovo watching on his exercise bike down there in the Balkan states. This is John and Mrs. John. I do apologise, I don't know your name, but I do know you watch in Spain, so thank you for that. And this is the wrong way up. Is that it? Yeah. This is Jiwa, who watches in Pakistan. Excellent. Quite amazing the way that people watch in different countries of the world. This is about 1/3 of the face of Paul and Kelly. And watching me when they're cooking dinner. Watch you don't burn your hands. Thank you, Paul and Kelly. This is Ken, who watches in Jamaica. Good to see Ken's watching in Jamaica. This is Larry and Terry watching in Long Island, near New York, I believe. Lee and John, who watch in Sheffield. And they do share the same household, so that's fine. This is Melissa in California. I think Melissa making jewellery of some sort, I think. It looks something like that, I think. So good to see you watching anyway, Melissa in sunny California. Oh, another Melissa in Texas this time. Seem to be in the southern United States today. It wasn't planned, it's purely coincidental. Good to know you're watching in Texas, Melissa. This is Melody in Silicon Valley, California. Homemade mask, I'm sure. Excellent. Thanks for that, Melody. Mick and Sarah from the northeast of England. And like where I am, the sunshine is not quite as abundant as we would like it to be. So thanks for that, Mick and Sarah in Gateshead in the northeast. This is Mike in British Columbia. Thank you for watching. Well, that must be Mike. Sorry. This is Kristen. Hi, Kristen. Right, so Mike and Kristen. Sorry, Mike was in the shadow there. I didn't see you, my friend. These big screens, it must be really disconcerting seeing me on such a big screen. Anyway, thanks for watching in British Columbia. Oh, this is the Nicholas family, also in Canada. Always nice to see the family watching. So hello also from England. Great to see you watching as a family in Canada. This is Pam, who's camera shy but sent her dogs in the United States. This is Pamela. This is pure coincidence today. This is another Pamela in Connecticut. So good to know you are watching in Connecticut, Pamela. And that is the last picture for today.